To have an operation on both knees at once is a good and difficult question to answer. It has one big advantage in that it's one recovery. A lot of people would say once they've had one done, they wouldn't come back for the next one. And it's only slightly more painful having both done at one time and only slightly longer recovery. There is, however, some concern that there may be increased risks of blood clots going from the leg to the lungs with doing both at one time. And so you will find some surgeons will never do it, and other surgeons who are quite keen to do it at the one time. I would only do it in patients who are well and who are not elderly. For example, it is a big stress on the body, and you need to have a good heart and good lungs and generally be fairly stoical to undergo having both done at one time. In addition, I leave it up to the patient. If a patient comes to me and says, I would like to have both knees, and if their eyes fit and well, then I will usually go along with it. However, if they don't raise it, I will usually not encourage them to take it on.
I just couldn't move. I remember one day, before I had my knees done, I was going to a meeting across the road from Premier and Cabinet to the health department, and I got halfway across the street and I got stuck. The pain was just so unbearable, like rocks on rocks. It was just terrible. So I stopped mid-road, crept back to my office and rang my orthopaedic surgeon in Hobart, and he said, "Oh, come and see me." So I rolled up to him the next day and had some x-rays done, and he said, "Yes, we'll definitely do the left one, and then 6 weeks later we'll do the right." And I'm working full time, so I said to him, "Is it possible to have both done at once?" And he said, "Well, it's not very common, but I think you would be able to cope with it well." I had the bilateral total knee replacements, I think it was a Wednesday afternoon. Then on the Thursday morning, the medical staff came round and said, "Right, Judith, we're going to get you up." I thought, okay, it's a bit early, but... So I swung both legs over the side of the bed and stood up. And of course it was excruciating. But the pain was completely different from arthritic pain. It was the pain associated with, muscles and tissues and, surgical pain. It wasn't that rocks on rocks, grinding, grating pain that I'd had prior to the operation. And the other thing is, I had a goal about what I wanted my knees to do. Because I worked at Premier in Cabinet, every so often I had to go over to the Premier's office, and he had this gorgeous furniture, but the seats were so low. And I'd get over there and I'd get into one of these seats, and then I just couldn't get up. So, well, not elegantly. So I said to the orthopaedic surgeon, "What amount of flex do I need to get out of a low chair?" And he said 140 degrees. So that was my goal. So after I stood up, about the next day after that, we started on physio. And my goal was to have that flex before I left hospital, in fact. And because I'd had both knees done, I remember lying on the bed doing the exercises, the cycling and all that sort of stuff, and then would get measured. And I was determined that they were both going to be the same. I mean, my left knee was more damaged. It took a little longer, but I still remember the day it reached the same level of movement as the right knee. And then when I left hospital, I did another 3 or 4 weeks of intensive physio, maybe twice or 3 times a week. Went to a private physio then and continued. And I've done that with all my joint replacements. I've had an intensive and extensive physio after the operation. With my joint knee replacements, I did ask the orthopaedic surgeon how long recovery time would be, and he said that for most people it's about 12 months before you feel, wow, this is really worth it. Personally, I arrived at that a little earlier, probably because I was back at work and didn't have time to think about myself. But it is probably about 12 months. After that, you get to the point where you actually even forget you've got joint replacements because there's no pain, you can do what you want to do largely. And then you have to remember to respect your joints.